Proper diagnostic tools are needed to find out if a patient is suffering from long COVID. Experts say many elderly patients who have long COVID are not even aware they have the condition. Some of their pre-existing conditions mask the long COVID symptoms, and if they are not treated properly and correctly, it could lead to more health problems.
Some patients who've had COVID feel breathless and forgetful, and these symptoms might prompt a visit to the doctors to find out what's wrong and if they are suffering from long COVID. Diagnosing the condition, however, may not be as straightforward as taking off a checklist. This clinic at the National University Hospital orders tests to eliminate other possible conditions before forming a diagnosis.
We will, go through all the kind of available, patient data, and then maybe we can add up some, additional, tests to discern the, whether it's a really, organ damage related presentation, or is simply, some symptoms, related with long COVID.
Long COVID is not a formal medical condition or diagnosis. Rather, it refers to a range of varied and persistent symptoms experienced by some patients after COVID. While some experts say that incidences are expected to decline with time, not having clear diagnostic tools could mean it's difficult to find out who had the condition.
The symptoms are quite non-specific. It's very difficult to actually look down and say, were these symptoms due to COVID or were they due to something else?
Pre-existing conditions in elderly could also add to the difficulty of diagnosis.
I think one of the reasons why we don't see it so much amongst older adults is that they have other medical conditions and they may have some long-term symptoms and they just don't really know what is due to long COVID and what is due to, their other medical complaints.
Well, for those who are recovering from long COVID, help is on hand to help them get better faster. A team from Tan Tock Seng Hospital, together with a developer, have created a mobile app that allows patients to exercise at home while at the same time monitor their activity levels. Recovering patients have found it hard to get back to what they have been doing. A ring to be used with the app is also able to track the patient's heart rate and oxygen saturation. The team wants more elderly to use the app.
They probably need a longer time to recover. They would be less likely to be able to go out to exercise on themselves, and they would probably need supervision. So the app would be helpful because it will enable them to exercise remotely.
TTSH is aiming to launch the app by early next year.